Hi, my name is Diana Soto, and I'm a student through Indiana State University, and I'll be presenting on gestational diabetes. Some of the learning objectives today are the following. First, I would like the audience to know what is gestational diabetes. Second, the audience will know signs and symptoms of gestational diabetes. Third, the audience will have a general understanding what the hormone insulin is. 4, the audience will know how gestational diabetes is tested for in pregnancy. And 5, the audience will learn ways to prevent gestational diabetes. Before I begin the rest of the presentation, be sure to click the link below for the pretest. What is gestational diabetes? Gestational diabetes develops during pregnancy with women who were not previously diabetic. Your body begins to develop an insulin resistance during pregnancy, which causes high blood sugars throughout the pregnancy. Due to hormones that are produced with the placenta, the glucose tends to build up in the blood, and the pancreas cannot keep up. The hormones in your body will also cause you to gain weight, and again, the insulin will not be as effective. Gestational diabetes can be classified with Class A or Class B, meaning that Class A is managed through diet and exercise, while Class B, women can manage their diabetes through medication and insulin. Gestational diabetes does go away after birth. What are some symptoms associated with gestational diabetes? So mothers may tend to notice that they are more thirsty, they may feel hungrier than usual, and they may be urinating a lot. This is the body's way of indicating that there's a lot of blood sugar circulating in their blood. Since their cells cannot intake the glucose, they feel hungry because their body's not intaking all the energy from the glucose. And your body tries to urinate a lot to get rid of all the extra glucose circulating in your body. Now we're going to talk about how you would be tested for gestational diabetes. So gestational diabetes is usually checked during the 24th to 28th week of pregnancy. The doctor will have you do a 1-hour glucose tolerance test, which is standard for all women during pregnancy. So you would get a 50-gram glucose tolerance beverage like the one shown here on the slide. You would have to drink that less than 5 minutes, and then the lab will draw your blood. You would have to fast 8 hours prior to this test, and you may have to stop medications a few days prior that can alter your blood glucose. If you have an abnormal blood glucose reading at that time, then your doctor would direct you to do a 3-hour glucose tolerance test. Again, you would have to fast at least 8 hours prior to the test. You may have to stop medications that may alter your blood sugar levels, which your doctor will notify you which ones to stop. When you go in for that test, you would have to drink a glucose beverage again, anywhere between 75 to 100 grams. It's usually dependent on the weight of the patient as well. So you would fast 8 hours prior to this test, go in and get a fasting glucose level first. After you drink the juice in less than 5 minutes, you would wait 1 hour, get another blood draw. At the 2-hour mark, you would get another blood draw. And then finally at the 3-hour mark, they would draw your blood again. And for this one to be considered a failed glucose tolerance test, you would have to be abnormal in at least 2 of the blood glucose readings. Ideally, they would want a fasting glucose of less than 92 milligrams per deciliter, a 1-hour glucose of less than 180 milligrams per deciliter, and then a 2-hour glucose less than 153 milligrams per deciliter. And this is by the LabCorp recommendations. What are some health problems associated with gestational diabetes? I will talk about a couple of them in this slide. So the first one is the mother can be at increased risk for high blood pressure, which in turn can lead to preeclampsia. Fetal macrosomia, which is a large infant. Due to all the nutrients and sugar the baby is receiving, they will probably be larger than normal. Hypoglycemia to the infant after delivery. When the baby is in the womb of the mother, the placenta is delivering high glucose to the baby if she does have gestational diabetes. And the baby produces a lot of insulin to counteract that glucose that's being sent to him or her. Once the baby's delivered, their body continues to produce a lot of insulin. However, they aren't receiving all that glucose from the mother anymore as before, so the baby would be hypoglycemic. Preterm labor is another complication. A need for cesarean section due to the large baby. A slower healing from cesarean section. And the mother can be at higher risk of developing type 2 diabetes later in life. It's very important to know some symptoms of hypoglycemia or when your blood glucose is low. So hypoglycemia is defined when your blood sugar levels are lower than 70 milligrams per deciliter, also known as hypoglycemia. Some symptoms you may feel is you may feel hungry, you may have some headaches, you may feel dizzy or shaky, you may feel confused, you may be pale or diaphoretic, may cause you to feel weak, you may feel anxious or cranky, and you may feel like your heart is beating really fast. If you notice these signs or symptoms, if you have time, be sure to check your blood sugar. If it's less than 70 milligrams per deciliter, then you want to quickly administer 4 ounces of fruit juice, milk, or any kind of soft drink that has some sugar. Or if you have a piece of hard candy available, go ahead and take that. After 15 minutes, you should check your blood sugar. If it's still not improved, be sure to repeat the steps again. And make sure that you're having at least 15 grams of protein. So you can do anything like peanut butter, cheese and crackers, something with meat in it or protein to help sustain your blood sugar. The following are some signs and symptoms of hyperglycemia. So hyperglycemia is defined as a blood sugar where the number is over 130 milligrams per deciliter. Some symptoms you may feel is you may feel thirsty, you may have headaches, you may be going to the bathroom often, it may be hard to pay attention, you could have blurred vision, you can feel weak or tired, and it actually can increase your risk for yeast infections as well. If you notice these signs or symptoms, be sure to talk to your doctor. But some things you can immediately do to kind of help get the blood sugar down is you can engage in some exercise, and hopefully that can help reduce the blood sugar. And then of course, be sure to watch what you're eating. What are some ways that you can prevent gestational diabetes? First, you could lose weight if you're overweight prior to pregnancy. You can watch your sugar intake. You can avoid gaining weight too quickly during your pregnancy. And be sure to engage in regular physical activities. You want to make sure you're eating a healthy, balanced diet and that you're watching your blood sugars to make sure you are not possibly developing gestational diabetes. Thank you for listening to this presentation today. Be sure to click the link below to do the post-test on gestational diabetes. The following slide has some resources that you can look at to learn a little bit more about gestational diabetes and how to manage it.